Well, welcome back. Playing sports is a great way to keep your kids moving, but there may be some risks that you might not know about.
Orthopedic surgeon with Memorial Hermann Ironman Sports Medicine Institute, Dr. Gregory, is joining us now with ways we can all prevent common youth sports injuries. Dr. Gregory, it's great to see you. Welcome to the show. And let's start just with a number. So I understand there are 35 million youth athletes participating in these sports around the calendar every year. That translates, I'm guessing, also, doctor, into a lot of injuries.
Absolutely. About 800,000 a year show up in the emergency rooms across the U.S., all related to sports injuries.
It's really incredible when you break it down to that particular number. Of course, my kids are baseball players. I've got kind of a extreme sports kid that likes BMXing and skateboarding. But all of these athletes, whether they are on a field, softball, baseball, gymnastics, do you think that there should be some sort of mobility or stretching taught to our kids to help them kind of prepare or maybe avoid an injury?
Absolutely. So in my opinion, not only a mobility routine, but a strength and conditioning routine throughout the off season as well as during the season can help avoid many of both the overuse injuries and the acute traumatic injuries that our young kids suffer in the sports season. Of course, your BMXers and your more extreme sport athletes, some of those falls can't be avoided, but a lot of our more organized sports participants, a lot of what we can do in the off season to increase their strength and make sure they're maintaining mobility as they grow and as their bones kind of lengthen quicker than their muscles and tendons can absolutely help minimize some of these injuries.
It's so interesting that we're chatting about what to do during the off season, because I feel like, Dr. Gregory, a lot of parents may think like, okay, the season's starting, now's really the time to focus on it. But let me just be sure I'm understanding. So there's actually a spike in these injuries after the off season, right? Due to just the inactivity.
Exactly. So there are kind of two main times that we see these overuse injuries. One is at the beginning of the season, actually, because not all of our athletes have spent the off season getting stronger or staying fit, or kind of near the end of the season after they've been playing for a prolonged time and have kind of worn out the muscles, tendons, ligaments. So there's kind of two areas, and we're kind of approaching that first area after this prolonged COVID off season, if you will.
And I think it's really important too. Sometimes if parents say, oh, well, my child is not, is too young for this type of strength and conditioning, or what are we talking age wise? So whether you're playing t-ball or you're, 7, 8, or 9, as opposed to like somebody in high school age, should all of those ages be age appropriate as far as those strength and conditioning and mobility?
That's a great question. So for our very young athletes, so our, kids in elementary school, most of what we're doing is trying to keep them engaged in sporting activities by making it fun. So it's a lot of more body weight activities or kind of teaching the foundations for how to do some stretching and strengthening while maintaining a fun atmosphere. Of course, for our more serious adolescent and high school athletes, they are often on school teams as well as club teams, and they do see a lot more of a traditional strength and conditioning program using weights and things like that. But the sooner that we can engage our athletes into foundational strengthening and stretching programs, the better.
Dr. Gregory, let's talk about what happens if there is an injury, right? No one wants to hear news of their child being injured on the field, but why go see a sports medicine surgeon? Because for some parents, they may freak out just the word surgery, but there are also a lot of ways you can get an athlete healed and back on the field without surgery.
Totally. And so as a sports medicine surgeon, obviously surgery is what I love to do, but that's just one tool in my toolbox. Thankfully, based on the fact that we're collaborating with Ironman Sports Med Institute, we also have physical therapists, nutritionists, athletic trainers, strength and conditioning coaches who can all help us treat our athletes in a more holistic way. Additionally, the benefit of coming to see a sports medicine specialist right out of the gate is that we don't have any delay in diagnosis, and we're not at risk of making something that could have been treated non-operatively at first into an operative problem by not managing it appropriately out of the gate.
That's such a great point too. Let's talk about the Game Ready series. This is really fantastic, and it's something that y'all are doing on Facebook.
Yeah, so Game Ready came out of kind of some of my more at home time in this pandemic. So I was thinking how much I enjoy engaging with my athletes in training rooms and the community through different talks, but we don't have those normal venues right now. So I collaborated with other orthopedic surgeons in my group, as well as primary care sports, nutrition, sports psychology, to come up with this series featuring experts from all over the city every Tuesday and Thursday night. So geared at athletes, parents, athletic trainers, and coaches for returning to sport safely and avoiding some of these injuries that we're talking about.
Well, Dr. Bonnie Gregory, thank you so much for your time. Thanks for helping to keep our young athletes safe. And in the meantime, if you would like more info, you can call 713-222-2273, or you can visit ironman.memorialhermann.org. Doctor, thanks again.
Thanks, Joel.